Good afternoon, everyone, and welcome to this very special announcement. We're thrilled that every one of you is here with us today because we have some good news, wonderful news for you, which I will share in a few minutes. This will be my final Cities Thrive meeting with you as First Lady of New York City, which, of course, stirs up all kinds of emotions. More than anything, I'm overwhelmed with joy and excitement for where this coalition is headed because this coalition is not stopping. Today is the beginning of a new chapter in this movement that we built together. As some of you may remember, our first Cities Thrive conference was in November 2016, 1 week after the presidential election. Well, let's just say it was a fitting moment. We were a bipartisan group, deeply concerned about our families and the communities we served. And what I remember most is the feeling of solidarity that we shared. So many of us had struggled alone for a long time. And the second we came together, we knew we had found our people. With a refreshing wave of new connections, we nourished our souls and we laughed. There were some tears, of course, with all those personal stories. And we really believe that together we could change the conversation around mental health in America and break down the barriers to care. Now, here we are recovering from COVID, and that mission has never felt more urgent. More Americans are having open, honest conversations in a way that would have been impossible to imagine when we first came together just a few years ago. Mayors, county leaders, so many people are saying mental health has to be part of policies and budgets. And at the federal level, we have an administration that is committed to a more integrated approach to behavioral health, one that is invested in community based care and the mental well being of our students and values the work we are doing locally. This is our moment, and we must seize it together to shape the future for our families. Cities Thrive has made some remarkable progress. We brought elected officials, policymakers, and faith leaders into the world of mental health. We helped them understand what was happening on the ground from different perspectives. We brought decision makers together for different kinds of conversations, encouraging unprecedented partnerships. And we have taken action in our own backyards, with cities like Huntington, West Virginia, aggressively tackling the substance use and opioid crisis, Denver, Colorado, locally funding behavioral health services. And here in New York City, where we introduced a social emotional learning curriculum in 2019, we launched universal social emotional screenings for the first time this fall with more clinics and additional health professionals to support those in need. Without federal leadership or guidance, we have given each other a support system to lean on. And as more voices join the conversation, we help more leaders see that mental health cannot live in a silo. It is the province of every agency, every policy, and every individual has a role to play. And as our voice as a coalition grows stronger, this movement will become more powerful. Our goals are ambitious, to say the least, but I am confident in this movement. As I remind our members, you are Cities Thrive, and Cities Thrive is you. The strength is in our people, our connection, and our shared commitment to the work. For 5 years, we have grown together. And over the past year, we've been hard at work building a structure that will lead to continued success. Which brings me to our two big announcements today. First, starting next year, 2022, the Cities Thrive Coalition will have a permanent home as part of the National Council for Mental Wellbeing. As many of you know, the Council has been a terrific partner to the coalition this past year, sharing their resources and partnering with us on important discussions like our July congressional briefing on mental health equity. And I know many of you have worked with the Council in your own communities. Their resources, their incredible team, and their deep connection to our communities, all of those things are going to help us move this coalition forward. Now, The other piece of news, which is equally exciting, I am elated to announce the coalition's two new co-chairs, Mayor Hillary Sheevy of Reno, Nevada, and yes, and Mayor Michael B. Hancock of Denver, Colorado. Now, Chuck will give them a full, proper introduction shortly, but I have to say that both of these mayors feel this mission personally, deeply. They have been innovators in their own cities, and they have proven themselves to be exceptional collaborators and champions for the work. In just a few minutes, they will speak about their connection to this movement and why they have volunteered to lead the charge. Today is the beginning of a new chapter, and I couldn't be more proud to be part of it. That said, I now have the pleasure to introduce the remarkable leader who made today possible. He is a visionary. He has more than 28 years of experience in behavioral health as a provider, advocate, and an educator. He and his team have already put their passion and experience to work for our cities and localities, and they are ready to go so much further with this coalition. He's a great friend and the president and CEO of the National Council for Mental Wellbeing, Chuck Ingoglia.
Thank you so much, Shirlane. What an honor it is to be here today and to have the opportunity to continue the incredible work that you started. Your vision, your passion, your commitment are infectious. That's why so many of us have wanted to work with you to continue this movement going forward. So grateful to you, to Debash, to all of your staff for the leadership that they have given, and in drawing out all of the other coalition members to raise up so many voices, to highlight so many successes around the country. It's just really a pleasure. I'm just going to take a few minutes to talk a little bit about the National Council. But you introduced me as a provider and an advocate, but most importantly, I'm also a family member. And coming to this work based on my own experience of understanding, the challenges that confront families and individuals when they seek care. And that's really what my life has been all about from an early age, is how can we create a system that is more accessible, that helps people achieve their full potential. And that's also the story of the National Council. Franny, can we go ahead one slide, please? The National Council for Mental Wellbeing, we have a new name, but a long history. Our organization started almost 60 years ago. We were part of the vanguard of trying to figure out, what does community-based service look like for people living with mental health and substance use challenges. This movement that began with realizing that people could live, function, recover in their communities, being near their families, their friends, having something resembling a life like all the rest of us have. This notion of community-based care was at the foundation of the Federal Community Mental Health Center movement, that vision that President Kennedy had, and that the National Council was created to help bring to life. And this movement is all about making sure that people can have full, complete lives, even if they have a mental health or a substance use challenge. That's really what we are about. Our members continue to innovate and try to achieve that in their communities. Franny, can we go to the next slide, please? So the National Council is an organization that has member organizations around the country. We're a network of state associations. We're a network of people who care about innovation and access to care. And I think one of the things that has been most exciting for me to be part of the National Council is that, we are a membership association, but we're also seeking to partner, to learn, and to grow. And I came across a quote again yesterday from Helen Keller. Alone, we can do so little. Together, we can do so much. And that's always been kind of the vision of the National Council, where we can convene and partner and work together to advance change. The next slide. So you may have encountered National Council member organizations. We actually have members in every single state. They provide a wide variety of prevention, early intervention, treatment, recovery supports, and they come with all different kinds of names, everything from community mental health center to addiction treatment organization, federally qualified health center, and all kinds of things in between. What they all have in common is this commitment to provide care and support to help people achieve full lives. So that's what all of the National Council members have in common. And as a national organization, we try to create an environment that supports that vision. And the next slide talks about how do we try to do that? Well, one way we try to do that is through public policy, trying to affect change at the federal level, so that we have the regulatory policy and funding environment that makes it possible for local organizations, for cities, for counties to have the resources necessary to affect change. And so that is what we focus on, is how can we create an environment that makes it easier for localities, for organizations to provide treatment. And it's by working together that we kind of affect this change, working together at the national level with other organizations, at the community level with folks like you. And one of the things that we're looking forward to is continuing this tradition of hearing from you of what's important, of developing strategies collaboratively, of learning from each other and trying to celebrate and promote success. So that's the way that we like to work. So one way that the National Council advances our vision is through public policy. And another way, on the next slide, we also want to create an environment where people understand that mental illness and substance use is real, that it's common, and that it's treatable, that recovery is possible with the right treatment, interventions, and supports. And, I grew up in a family where I didn't understand until I was in my social work program that my mother wasn't just weird, that she had a really serious anxiety disorder. But as a family, we didn't have the language to understand that that's what was occurring. And as a result, my mom never received treatment, that she never was able to have a full life. And our family suffered as a result of that. We don't want that for other people, right? We want everybody to understand what's occurring and to have access to the kind of care and support that they need. We've had wonderful champions over the years in promoting mental health first aid as a foundation to mental health literacy, like the incredible Shirlane McRae in New York City as part of New York City Strive, First Lady Michelle Obama, but so many other localities around the country who have recognized that we have an opportunity to educate, to inform, and to change the conversation. Additionally, City Strive will be able to participate in other National Council activities. We will continue to hold the convening that we've all grown accustomed to, and hopefully next year it will actually be in person, but we'll do it in conjunction with the National Council's conference and Hill Day. And so we'll have opportunities for Cities Thrive members to have their own convening, but you'll also have access to the broader conference, which historically has drawn about 6,000 people, all of the keynote speakers, other kind of leaders that will be there. So we're really looking forward to being able to continue to support the activities of Cities Thrive, but to make you, to give you access to this larger kind of audience and resources that we have. The next slide talks a little bit more about this, that we have a variety of projects and papers and trainings and ways that we can connect you to resources that you need as you're looking to solve local challenges. We also have the benefit, right, of this national network of 3,500 organizations, which we also hope to use to build the Cities Thrive Coalition, to recruit additional members of the coalition. And we will continue, again, as I said earlier, to have opportunities to engage you, to get your input, to make sure that what we're doing actually makes sense to you. So we're just so excited. I don't want to bore you with more slides, but as the First Lady said, we also want to make sure that as we move forward, we're continuing to hear from and be led by city leaders. And that brings us to our next discussion, which is about our co-chairs. And we're so grateful to have two local leaders who are willing to serve as co-chairs of Cities Thrive. And first, let me also introduce Mayor Hillary Sheevy from Reno, Nevada. She is serving her second term in office. And Mayor Sheevy is a very passionate mental health advocate at the local and national level, advocating for what she calls a mental health first approach with access to care regardless of income. She reinforces the role of cities to create safe communities, to break stigma, and to eliminate the use of jails as mental health hospitals. Under her leadership, the city of Reno was named the first hopeful city by the International Foundation for Research and Education on Depression, Hopeful Cities National Initiative. Importantly, Reno residents now have access to a menu of free or low-cost mental health resources. Mayor Sheevy, we are fortunate to partner with you moving forward. Would you please share a little about what the coalition means to you?
All right, thank you so much, Chuck. I am so excited to be here. I don't know if we can go to a different screen if that's possible so I can see all of you. Is that possible? There you are. Hold on, there we go. All right, you guys, hello. And I just want to say thank you so much to First Lady Charlene McCray. I can't even begin to tell you, she doesn't know this, but I'm going to tell you just a little story about her. The very first time I saw her at the Conference of Mayors, she was standing across the room and I followed your work and her work. And someone said, there's Charlene McCray. And I said, oh my gosh, I have to meet her. I have to meet her. And I said, I one day aspire to be just like she is. And so I have to tell you, I am such a massive fan. And for all that you have done in the space of mental health, I just can't thank you enough. And I've been enamored by you, but I have to tell you, I think there's, so many obviously milestones in a political career, right? But this is a personal milestone for me and such an honor to be a part of Cities Thrive and all the work that all of you are doing. But I just have to tell you, thank you so much to First Lady McCray, because it is your work that has paved the way for cities to really address this issue and the stigma that goes along with mental health and all the things that it encompasses. So without your leadership and vision, none of this probably would have ever been possible. I know, where I am today, it was a lot of people that supported me. And so I'm so grateful for your support, First Lady, and just know I couldn't be a bigger fan. So thank you. Anyway, I'm excited to meet everyone. I'm excited, obviously, to get back in person. Chuck was talking about the days where we will all get to meet, and that's really important to me because I think, we all do better whenever we have the support of each other and just being in person. And so I think, these last 2 years for all of us have been incredibly, incredibly challenging. For those of you that don't know me, I am the mayor of the biggest little city in Reno, Nevada. If you haven't come or haven't been in a while, come visit us. I think you'll like what we've done with the place. We've been predominantly a gaming city. And, I think too, my city is a little bit different if you don't have gaming in your city. And so, and I really done a deep dive in sort of my city and the infrastructure and all those things, because I really believe in a mental health first approach. I have to tell you, it wasn't until probably about 2 years ago that I really started to talk about mental health, but it's been something that as a little girl, I watched my grandmother struggle with. And then unfortunately, my brother and my sister both had depression and bipolar disorder. And so I've sort of grown up with it in my family, but I never talked about it, first of all, because of the shame, but I also never wanted to shame them. And being in the public, I was always trying to sort of hide from it and, hide from those things that, sort of are those big stigmas with mental health. And especially being in politics, I didn't ever want their, sort of the things that haunted them to be on the front page of the paper. So we always sort of hid this dirty secret that I had in my family. And I think it really came to a head whenever the pandemic started. We all felt so isolated. We started to see more anxiety now more than ever. And in people that never probably had sort of anxiety and depression. And so more and more people started to talk about it. And I think a mental health first approach in cities is so critical now more than ever. And my goal will be to really raise awareness with every single city and every single mayor, because mayors need to be talking about it. I haven't heard it enough from mayors. And now more than ever, I'm going to call upon each and every single mayor to join us and to stop the stigma, because I really think we have a huge opportunity to do so. I would say actually the last 2 years were probably the hardest 2 years I've ever been through. And I bet many of you feel the same way. Unfortunately, I lost my sister last year to breast cancer, but it was at a stage 1, and she became so depressed, and she had depression before that. She stopped taking her medication and we didn't know it. And the depression took hold. And she told me, she said, "Hillary, I would have rather have had cancer than depression. That is how debilitating that it is." She kept telling me, "I would rather have cancer than depression." And that just made me it just made me feel so horrible inside. And then 6 weeks later, unexpectedly, my younger brother, he died from an overdose, basically. And he was always, self-medicating because of depression and anxiety. And so I can't change it for them, but I can certainly change it for other people moving forward. And so I just feel so passionate about mental health and the ways in which cities can change and address this pandemic that we have not spoken about for far too long. So I'm very passionate. Like Chuck said, one of the things is we've got to stop treating mental health, in jails and treating our jails like mental health hospitals. That is just absolutely unacceptable. And treating mental health in ERs where they don't have the background of behavioral health and all these things that cities can do. And so I'm so grateful, like I said, to be a part of what you guys do. It's just such a tremendous honor. So I look forward to working with all of you. And I'm just, like I said, grateful to be here. And let's go out there and make, mental health first in cities. So hashtag mental health, hashtag mayor made me do it. Okay.
Thank you so much, Mayor Sheeby, for your courageous leadership in your hometown of Reno and for your willingness to serve as co-chair for Cities Thrive. We're so grateful to you. And we're fortunate also to be joined by our other wonderful co-chair, Mayor Michael B. Hancock, who's joining us from the Mile High city of Denver, Colorado. He's now serving his 3rd term as mayor, And Mayor Hancock has made major strides in improving the behavioral health of the citizens of Denver and reducing stigma and funding and leveraging resources across systems. Since 2020, Mayor Hancock has released the Road to Wellness strategic framework for access to care and has helped fund and start comprehensive programs like Empower Denver, the support team assisted response that pairs EMTs and behavioral health clinicians, and a 24/7 behavioral health solution center that provides innovative crisis response and recovery with reduced police involvement and incarceration. Mayor Hancock, we are honored to have you as part of the leadership of Cities Thrive, and would like to turn it over to you to share a little bit about your vision and your commitment to these issues. Thank you.
Chuck, thank you for having me, and to my colleague to the west of me, Mayor Sheevy, so good to see you, and thank you for being a part of this effort. I am honored to be your co-chair on this extremely important issue. And I'm glad to greet everyone as part of the City Thrive Coalition members, and thank you for your collaboration and efforts in this area, in your cities and across this nation. And if I can, just for a moment, to echo a lot of what Mayor Sheevy said about First Lady McCray. 7 years ago when we first met, and you and I had, I'll bet, a brief but yet significant conversation about the importance of addressing mental and behavioral health issues in our cities. We made a commitment then that we would follow up and have a conversation and figure out how we can further impact our cities and others across this country on this critical issue. You came and at least virtually and spoke at a gathering that I had of a council that I appointed to address the issue of mental health and behavioral health issues in our city. And they resulted, that report, or at least that body resulted in a report that created a new office for the city of Denver, the Office of Behavioral Health and Behavioral Health Strategies, as well as a whole plethora of new efforts in the city of Denver to help us to more effectively address this issue. So I am honored to be a part of this. And let me tell you why I joined this. One is because First Lady McCray and the leadership of Cities Thrive asked me to do it, and I'm honored that they came and asked me. But two, I as mayor, I can tell you, as like Mayor Sheevy, that as we work every day to address some of the critical issues facing our residents in our city, impacting it every day, we find that at the root of a lot of this are behavioral health and mental health challenges. And we've got to get serious about peeling back the layers and getting to the heart of these issues and stop masking them with addressing the symptoms. Mayor Sheevy talked about jails becoming our biggest mental health providers. Many of our jails don't even have mental health supports in them. And they didn't before I became mayor here in Denver, Colorado. And so really turning our attention to this and really dealing with the root of this has allowed us to really focus on this issue. And now today, every person in our detention facilities has access to mental health, and every one of our sheriff deputies is trained in critical incident response so that they have the training to know how to de-escalate situations and diagnose appropriately what they're dealing with while they're dealing with individuals in the jail. Let me just share a story, and I'll tell you what we're doing here in Denver that we hope to carry forth and sharing ideas as well as taking some of the best practices from around the country. About 7-8 years ago, right before I met First Lady McCray, I was having lunch with the former First Lady of the state of Colorado. And her name is Jeannie Ritter, and she and I were having lunch, and I knew she was in the mental health field, and I had requested this lunch because I wanted to pick her brain about what I was seeing in Denver as the mayor, and I wanted to really focus on getting to the issues of mental and behavioral health. We were having the salad, I'll never forget, in a very busy restaurant, and I said, listen, Jeannie, I gotta ask you a question. I really believe that everything we're dealing with today in Denver that plagues our city, I'm talking about the homelessness, the addictions, the crime areas, the family struggles that we're seeing. The root of all this is mental and behavioral challenges. Jeannie Ritter very loudly dropped her fork and screamed as if I stepped on her big toe. And she said, finally, someone is asking the right question. And from that conversation, I became a convert to really focusing on behavioral health and mental health challenges in our city to get to the root of everything that we're dealing with. Like many cities, we have faced so many major lawsuits because we were not responding appropriately to people who are very sick in our community. So we created the Office of Behavioral Health Strategies. We created the Co-Responder STAR program that puts mental health clinicians either out responding to 911 phone calls or sitting second seat for our police officers. Out of the thousands of calls, only one time have they had to call for a police backup because we're responding appropriately to the crises that are on our streets. We also released the Empower Denver program, our report, and part of the Empower Denver report gives us it really kind of taps into the large network of services, program providers, and stakeholders who are focusing in on behavioral and mental health challenges in our city and really creates a new opportunity for collaboration and resource gathering. And finally, just a year ago, the people of Denver went to the ballot box and committed a sales tax that will gross close to $40 million a year to address behavioral and mental health services and challenges in our city. We are just getting started with that program, that effort. And I'm very excited that we're starting to dole out those dollars and we're starting to see the impacts of that. But that's on a large scale in terms of what we need to do in this nation. That's like giving a well a tic-tac. We have got to get focused on this big, massive challenge in the nation. And I'm honored to be co-chair along with Mayor Sheevy to say, nation, wake up, continue to grow your awareness, but more importantly, adopt this sense of urgency that we have got to move and move appropriately to equip this nation to respond to this crisis, this growing crisis that existed even before the pandemic. So thank you, Cities Thrive. Thank you for allowing me the honor of being with you over the next year as co-chair. And I look forward to carrying this message and helping to equip as well as to learn from mayors all over the country.
Well, thank you so much, Mayor Hancock. I just appreciate your passion and your commitment and your partnership, and look forward to working with you and Mayor Sheevy going forward. And to all of the members of Cities Thrive, I look forward to learning about, celebrating, and spreading the innovations that you're doing in your community and figuring out ways that we can work together to improve the lives of people living with mental illness and substance use.